Hello. Anna, hello. Can you hear me?
Hey.
Hello. How are you doing?
And I think actually for the first time ever, our weather here is like almost on par with yours. I can't believe it. It's amazing weather here. It's so
Oh,
lovely.
lovely. Enjoy while it lasts. I was going to say, I should probably say good afternoon to you. I'm here with my cup of tea and it's kind of just past 8 a.m., but I should say good afternoon to you.
Oh God, sorry. I didn't.
Oh,
Of course.
I was thinking it'd be nice. I'll get up early, have a little chat to you, put me in a good frame of mind for the day. So thank you so much. And I was hoping if we could, I'll just do a little introduction, just give people a little bit of information about you. And then I will pass the floor to you for some interesting skincare tips and products.
Yeah, of course. Sure.
So, Anna's a very well-respected dermatology nurse with a wealth of knowledge and experience behind her. She's part of the editorial board for the Journal of Aesthetic Nursing and a specialist nurse advisor for the PMFA, which, if some of you don't know, is a journal that publishes on plastic surgery, aesthetic medicine, and dermatology. And I think you recently got runner-up for Dermatology Nurse of the Year, so congratulations on that. And personally, I've heard you speak a number of times, so I thought you'd be the absolute perfect person for our little interview for our social media audience and also for my skin transformation group. So if it's okay with you, I thought we could start off with a few of your sort of key product recommendations, and then I've got a few questions that the ladies would like to fire at you, if that's all right.
Of course, yeah, no problem at all. So I've basically got a number of products lined up here that are my favourites. I think are great in literally all climates and, you know, walks of life and lifestyles and whatever. Probably one of my favourites is this particular product here. I don't know if you guys can actually see that, but this is a product by Exuviance, which is the sister company to the Neostrata company, which is American in origin. And Neostrata, just to put that in context, is marketed and positioned very much as a sort of a physician and like a medical grade line of products. So it's in a lot of aesthetic clinics in the UK. But you do see it in some sort of esthetician salons as well. Whereas Exuviance is the sister company, has a very comprehensive range of salon products as well. And these are geared much more about the experience. They have a much more luxurious feel to them, whereas Neostrata is very clinical grade and really just kind of.
So this will be more sort of enjoyable to kind of use.
100%. But that said, it's not just a fluffy experience that has no anti-aging benefits to it at all. That couldn't be further from the truth with Exuviance. So what I'm holding up here is something called the Exuviance Skin Rise Barnic Tonic pads. And basically when you open the pads or open the pot, you get 36 cosmetic pads that are coated and saturated in an anti-aging and a very, very gentle antioxidant and very mildly exfoliating solution, which smells nice, it doesn't irritate. You could even use them on sensitized skin. You could customize them and use them after a cleanse, perhaps before you use a serum or a daytime product or, an SPF, or in the evening after a cleanse.
So would you be using them daily? Would that be a daily? Yeah.
You can use them honestly daily if needed. They're an enormously popular product. I think they're one of the best brands that we have at Aesthetic Source in terms of this particular product. It's a real hero of mine, and they smell and feel amazing. So you could use them on the face, you can use them on the neck, on the chest. And the serum that's on the pads doesn't need to be washed off in any way. It stays, so it's antioxidant rich, and it has some very advanced anti-aging ingredients in, one of which is lactobinic acid, which does so much. It gives very gentle exfoliation, it stimulates hyaluronic acid in the skin, and it protects the skin's natural collagen as well from being broken down from exposure to sunlight, and also protects the skin against pollution as well. So they're a luxurious item, but very, very powerful from an anti-aging point of view.
Would you say, I know you sort of mentioning sensitive skin, the lactobinic acid component, do you think then that would be good for kind of mild rosacea cases as well, or do you think they're a little bit on the stronger side for that?
They're probably, if somebody was going to use them with rosacea, they probably should introduce them into their regime probably about 2 or 3 times a week,
Okay.
and see how they tolerate it. Lactobaric acid is an inherently gentle ingredient anyway, so there shouldn't be any untoward irritation or sensitivity. But because they still have quite a powerful anti-aging benefit, it's probably best just to introduce them gradually. What a lot of my patients and a lot of our colleagues do with these as well to get them to last longer is they basically cut them in half, because there's such a generous amount on each pad that will last. You could use in the morning, one in the evening.
Clever.
And in theory that would mean that you had double the longevity out of it.
Brilliant.
Great tip. So they're an absolute favorite. After that, as part of a very nice sort of relaxing or sort of clinical grade treatment, we have something called our Bionic Oxygen Facial, which is also from the Exuviance line of products. And this is a very, very luxurious, nice treatment that anybody can do at home on their skin. And what this does is you pump out a very generous amount of like a sort of a gel-like serum. And it's got great, it's got glycerin in, so it's very humectant in terms of its properties anyway. And as the name suggests, what this does when you put it on damp skin that's clean, and it takes about sort of 3 to 4, even 5 minutes to bubble. And as it bubbles, it pushes or encourages uptake of free molecular oxygen, which is what's in it, which is great for cell turnover, keeping cells really healthy, nourishing cells as well, and it's full of antioxidants. So that's a real hero for us. As I say, we have that salons and a lot of clinics carry it in like a big back bar size as well, and use it as part of like a very sort of a mild chemical exfoliating peel as the final stage to just get the oxygen into the skin to encourage the healing and the oxygenation. But
and do you know what, it's nice that you've got that you've sort of introduced a couple of products that do kind of smell and feel a little bit nicer, because sometimes that is a little bit of a barrier for clients when they get their products home. And yes, they're really great, they're really powerful, and they can see the effect, but also it's nice to have some pleasurable products in there that are still doing something really, really powerful and really successful, but that don't smell really medical grade.
And this is so true, and this is why Exuviance, I think, has a very unique position in the marketplace, because there are so many skincare brands out there, so much confusion about what's on the high street, how does that marry against something like this. But this is the perfect synergy and the compromise between something that is clinical grade, that is powerful, that delivers, but it's about the experience and about the feeling and the smell, and it just,
which is important. You have to somebody has to want to use these products.
It's hugely important. So again, in terms of frequency with this, really, you could be looking at 2 or 3 times a week. It gives your skin just a nice boost, and almost like a workout as such, but just gives it that real hit of oxygen and antioxidant benefits. So that's amazing and so easy to use. And once it's sort of foamed on the skin, that takes about 5 minutes, and you just wash it off with cold water. There's no residue, there's no tackiness to it. As I say, the glycerin that's in it is just to give some extra moisture to the skin. So that's amazing. Also within the Exuviance line, it's probably easier if I just do it by brand.
Yeah, absolutely.
We also have these, so the box for these looks like this. So these are the Exuviance, the vitamin C20 serum capsules.
Sorry, what percentage was that?
20% vitamin C.
20%. Oh, fabulous. Okay, lovely. So quite a high percentage then.
Really, really high percentage. But the other, again, I think the other unique thing with these is they have a proprietary ingredient from the Neostrata company, which is aminophil. Aminophil is a very interesting ingredient because it's an amino acid derivative, and when it's applied topically to the skin, I mean, it's in a number of the Exuviance, it's also in quite a few of the Neostrata products, and in a peel as well that we use it in. It has the ability to stimulate collagen precursors literally within about less than 4 weeks.
Wow.
So in terms of very, very, very high strength antioxidant and collagen renewal, to be fair, from the, you have the added advantage of this high strength aminophil ingredient in it as well.
Yeah.
So these are great. We tend not to combine these really necessarily with treatments. These, I mean, some salons do have very nice medical grade facials with these built in, but these are also more than anything a standalone. So the capsules basically, I don't know if you can see that, look like, and then you simply just twist off the top, and then you can see what comes out is a very generous quantity.
Oh, funny enough, I was expecting more of a serum texture, but actually it's more of a cream, isn't it?
It's like, so, I mean, but it goes in skin really well.
Yeah.
The only thing, I mean, I love these, and I actually use them as a nice hand treatment as well, because I think we always forget about our hands when we're driving outside all the time. Like, get sunscreen on your hands. But I think these are so lightweight. I mean, obviously, it's a shame to waste it on your hands, obviously, but because the strength of the vitamin C is so high in these, sometimes when you use them, because of the strength of them, there might just be some very mild tingling that some people feel when they start using these. It's not an irritation. It's just an initial acclimatization to the actual, you know, to the very high strength of the vitamin C, because it's the highest bioavailable percentage to actually have an effect in the skin. So they're amazing. They're probably some of my top products from Exuviance. All fantastic, and you could actually make a really nice regimen out of those three alone. So you could cleanse, these or that, you know, you could really mix it up and it would just be amazing, truthfully.
And how would you, if you wanted to build in a slightly stronger regime, would you be able to factor in a retinol with that sort of, and then just take it up a level?
Just as you acclimatise. Both Exuviance and the Neostrata company have their own encapsulated slow delivery retinol based great. So they have a product within the Neostrata line as an example called the retinol NAG, and within the actual formulation it's packaged so it's airtight and stable, because retinol is a very difficult molecule, I think, for formulation specialists to work with. So the active ingredient and the percentage in the actual formulation is much higher than what's actually on the skin and then gets converted into its acid form. So it starts off as a 2.5% within the formulation, and then through the very clever delivery system in it to minimise the irritation that some people can get with retinol, it actually converts down to a much lower percentage of 0.5%, which is still very powerful actually inside the cell. So that's how Neostrata kind of get around using retinols in their formulation. But even if somebody was using any of these products, and they, you know, they're well acclimatized, and some people acclimatize quicker than others, some people use them more regularly than others, but there is absolutely scope with anything I'm going to show you to add in some sort of vitamin A type product or formulation into it, for sure. So actually then, while we're on vitamin A, maybe next I might just bring you over to our some of our Skin Better Science formulations. So this is also an American company that's based in Arizona. And as you can see, the packaging, they come in beautiful boxes as well, like rose gold and navy blue or rose gold box. But that's what the bottles look like. So you literally twist the top and pump, but they're beautifully packaged.
Yeah, gorgeous.
Really lovely. So they have a really interesting story. So the Skin Better Science story is a physician level range. None of it's on prescription. It's all considered a cosmeceutical range. But there are just over 15 products in the range in total, because it's designed to be within, you know, perhaps as an example in the physician's clinic, of being like one product having the ability to do maybe what like 3 or 4 others could do. So there's what that means. So their vitamin A is not like anything else I've ever come across, truthfully, in the aesthetic space. This contains their patented technology called Alpha-Ret. And what
I've heard of that Alpha-Ret. I've heard some really wonderful things. And actually, one of my doctors, I was chatting with one of my doctors a couple of days ago, and they were saying that they tried out this Alpha-Ret. I think it was the Alpha-Ret pads actually for the first time, and they were amazed. They were really, and they've tried all the retinol products. So I'm really glad you've been talking about that. Brilliant.
So that's great. So yeah, so they have like home peel pads, which I think for us during these circumstances, for a lot of our patients have been a godsend, really, to just, you know, have them using something at home that's clinical grade to just maintain the outcomes of their treatments in clinics. Yeah, they have they have like the Alpharet home peel pads as well, which are amazing, which we can talk about. But the Alpharet overnight face cream contains this very interesting retinoid type ingredient. So what Alpharet isn't, it doesn't fall within a tretinoin, so a prescription strength product, and we don't consider it to be a retinol either. It's a very, very different and a brand new type of molecule. And in technical terms, what they've brought to market is something called a double conjugated formulation. All that means in simple terms is that they've managed to actually bring together in the same formulation lactic acid, which is great for its humectant properties and exfoliation and great for pigmentation, with a vitamin A, and fuse them and bond them together. Now, what happens is when that then gets applied to the skin, there is something called hydrolysis that happens. So essentially the water content in the skin reacts and almost like unglues and releases the magic of what those two ingredients do, but with minimal irritation. So the hydrolysis allows the ingredients to be absorbed into the skin much more slowly. So as a consequence, we can offer individuals, not necessarily with rosacea, but individuals with more sensitive skin can now consider something like Alpharet as a high strength anti-aging formulation, because interestingly with this product, Alpharet is only one of the ingredients in it. So it also has niacinamide, which is vitamin B3. So that's amazing for barrier conditioning the skin. Very, very good anti-inflammatory properties. It's got something called Portoluca type extract, which is an anti-inflammatory. It's got hyaluronic acid in it. So it's got a lot of other humectant and barrier conditioning and antioxidant ingredients in. Another one, superoxide dismutase. So really, although it's Alpharet overnight face cream, it's so much more than just that interesting molecule, because it's got all of these other anti-inflammatory and calming ingredients in it as well. So this is one of the best products I found in the market, period, ever. And I think this type of vitamin A technology really takes the beating, because I'm thinking about where you are, for example, and the temperatures in Canaan. I suppose that, you know, it's difficult, I suppose, to be picking out products or ingredients for people that are not necessarily going to sensitize their skin. Now, I'm not saying if this was misused or overused in the wrong way, that it still wouldn't maybe precipitate some degree of dryness. But it's a very, very different type of technology. It's like, it's so far away from just another retinol. It's like, it's absolutely like night and day compared to the other technologies.
I guess it's reducing the inflammation and building the skin barrier at the same time as then applying the retinol. So you've you know, I haven't heard of another product that does both of those at the same time.
Truthfully, and I'm not here on the hard sell, truthfully. I know I'm commercially bound to aesthetic source, but I use these products myself on my own skin and in my own practices that I work from, and I wouldn't do that if I didn't think that they worked. But the Skin Better Science story is a very interesting one. So if we look at the even tone correcting serum, so this has part of this core technology is something called the Bright Complex, and that's abbreviated as text. It's just BRYT. So all that means is like this targets the brown discoloration, so like hyperpigmentation, that redness from chronic UV exposure, and the yellowness as well from more established solar elastosis. So again, even though, as the name suggests, it's a great standalone option for pigmentation, again, it's very antioxidant rich. It's full of ceramides as well. We've got 3 different types of ceramides in it. And it has an extremely high percentage of vitamin C from something called a kakadu plum extract. So it's very vitamin rich. Again, niacinamide, barrier conditioning ingredients. This is a real hero as well. So what a lot of individuals would do is use these two in combination. So that would be nighttime, and that's daytime under an SPF.
We got a number of ladies that they kept asking questions about the neck area, and because I told them I was going to be doing this little interview with you, and that kept popping up about the neck. Are those products suitable for the neck, or is that does that bring you on to?
something else just the neck. So truthfully, so we have a couple of options actually for that. If the issue on the neck from an aging point of view was more discoloration,
and pigmentation,
that type of concern, then you could definitely use this to target. But this is not designed really to treat laxity, which can be a real issue on the neck. So this is not so much about skin quality as skin discoloration and the many facets of age-related types of skin discoloration. In terms of tightening, we've got two hero products in our portfolio. One, which I think really takes some beating, is the Neostrata triple firming neck cream.
I've heard good things about this.
This is like this. I mean, I think for any formulation house to bring something to market that deals with pigmentation, that stimulates hyaluronic acid in the skin, that actually improves and targets signs of laxity in the neck without injectables or RF or even surgical options, it's a really tall order because it's a really tricky. This is a really difficult area with any modality. And basically this does everything. So in terms of, I know the name is obviously suggesting that it should be used in the neck, but actually it's designed to be used literally all the way up to the jawline, neck, and décolletage.
I was going to say we had a few questions about the décolletage actually, and a few ladies saying, well, what about, that's an area, like you said about the hands, that's an area that's often forgotten and has particularly high levels of sun exposure. So great to know.
This is really good. And to be fair, you could even layer it. You could do a layer of this. Perhaps if the sun damage is quite severe and quite long standing, and then you could do a layer of this. So this has a shea butter vehicle to it. So I don't know if you've seen.
I haven't.
This is like really rich. I don't know if you.
Yeah, I can see.
Very it goes one pump. Yeah. It goes such a long way.
You're going to be bathed in cream by the end of this interview.
Easter, so wrong. So yeah, it's such a great product. Anecdotally, again, customer feedback, and this is obviously off the indicated protocol for how it should be used. So one pump, as I say, in theory, will do full face, neck, and chest.
Yeah,
we've had feedback from customers saying that some of their patients have used it as a hand cream. It's quite obviously a very decadent hand cream on cost. And as you see, I'm still rubbing in literally liberally one pump across all my forearm and hands. So probably it's too generous an amount just for a single application for hand cream, but they've been doing it to improve signs of like sun damage on the back of hands. So it is logical, but it's obviously it's quite decadent. And probably one of the best ingredients in this there's two. There's apple stem cell extract, botanically derived stem cells, so it's appropriate for use. So that's obviously targeting DNA damage specifically in the skin in terms of like the radical changes that we see in terms of skin texture improvement. And the other ingredient that's interesting is one called neocitrate. So neocitrate is again another proprietary ingredient to the Neostrata company, and it has a twofold mechanism of action. Initially, when you apply it to the skin, it serves as like a sort of an antioxidant benefit to it, but then it hydrolyzes into citric acid. So it actually has, hydrating properties and actually helps to increase the innate moisture levels in the skin. The other ingredient that's very good in terms of tightening and natural hyaluronic acid production this can do is one called neoglucosamine, which you may have heard of. And that does so many different things in terms of exfoliating away very superficial pigmented areas in the skin, very gentle levels of exfoliation, and it also targets specific parts of the pigmentation formation pathway. So it actually we consider neoglucosamine a tyrosinase inhibitor as well. So that's a really high-end, hard-working, multi-mechanism product that does take some beating, I think.
In terms of the tyrosinase inhibiting effect, would you say, how would that be comparable with, for example, vitamin C, which obviously would be slightly less than something like a hydroquinone? Would you consider that to be a sort of similar level to vitamin C, or would you say more than that? Or
I think it's probably more powerful, and I think the reason why neoglucosamine, I think in terms of the context of that with Neostrata, they deliberately have utilised and formulated ingredients that do so much more than just one thing.
Yeah.
So neoglucosamine is a good example of that, because it's like it has a great synergy with retinol, so it can facilitate a quicker transition of retinol into its active form inside the cell. But truthfully, to come back to your question though, I don't know head to head how well it's even been tested in terms of its direct comparator effect to vitamin C in that capacity. But it does have very definitive clinicals to demonstrate an anti-tyrosinase effect for sure. But I'm not quite sure how that sits head to head with vitamin C, truthfully. But yeah, that really takes some beating. One pump, in terms of the clinicals for how quickly people should start to see results, that can be maybe a month.
Mm-hmm.
Again, depending on the age, the quality of the skin, lifestyle factor, the use of sunscreen, all of those other
factors that.
Because it's just important to remember with this doesn't contain an SPF in it. So we always just recommend when they start using it, if we're trying to treat areas of sun damage, then it's critical that obviously an SPF is used on top of this, because this.
And I would guess as well, if they're having other treatments, other clinical treatments on the neck area, I always feel like the neck is an area that actually you sort of need a multi-pronged approach some of the time to, treatments like Profilo and treatments like sort of skin boosters and peels and things like that can really work alongside these more medical grade creams.
Definitely, I agree. And I think, certainly at a time where we're not able to obviously be doing those treatments
right.
Now more than ever, we need to be thinking, right, well, what's out there? What have we got in our toolkits that has got, clinical grade outcomes and strong evidence behind it as well? And this, we've got this now in our portfolio since 2015, I think.
Mm-hmm.
But it's got such strong data behind it. It's a hero, and it's got a very firm place in our portfolio for sure. It's a really good technology.
Brilliant, wonderful, excellent, lovely. So have we been through all your product picks then?
Can I just show you two more? Sorry.
Oh yes, no, sorry, I thought we should go ahead, please.
Hi, Imogen, I'm sorry, I can literally just talk all day. So just
no.
On that Neostrata theme, the other one that I mentioned, Tritherapy Lifting Serum, is another one that's really, really worth a mention. This is lovely. So this comes in like a glass ampule with a.
This is a serum. Okay, yeah.
So this has in the portfolio. This is probably, I think, still probably the most advanced product Neostrata have brought to market to date. This has been a massive hit for us. This has been an award-winning formulation in its own right. And it's got the highest percentage of aminophil, that ingredient that I mentioned.
Yes.
Was in this has got like a 1.25%, which is the highest of anything in the portfolio. And interestingly as well, it also has some low molecular weight hyaluronic acid in. So it does offer that very powerful level of deep cellular hydration and plumping. And it's one of the products I think that we consistently get the best outcomes and the best feedback from colleagues and patients alike. And it also has another ingredient in it, gluconolactone, which is an amazing polyhydroxy acid that's very good for sensitive skin, great for preserving the elastin fibers in skin. And this, in terms of a red carpet treatment for anti-aging, can be used on the face, the neck and the chest.
Mm-hmm.
And then in the chest, you could layer the triple firming neck cream over the top. That's a very nice red carpet type of treatment or home treatment.
Yeah.
And then finally, sorry, then we'll come on to
No, please don't let me rush you. Please, I'm really interested.
So then finally, we have Oxygenetics, which is available in 14 different shades. These are some of what some of the bottles look like. They do have a shade match card.
Okay.
Recommend that gets sent first. Somebody can if they want, identify their shade, because this is great, because this goes up to even really dark Fitzpatrick skin types.
Yeah.
This was designed initially to be used straight after aesthetic treatments where skin was very compromised and very sore and vulnerable. Antioxidant, has vitamin E, aloe vera, has a UVA, UVB broad SPF protection, SPF 30, and it's a physical SPF. But the hero ingredient in this, in terms of like collagen renewal and like oxygen, if you like, facilitating oxygen into the skin and, you know, regeneration of tissue, is the ceravite complex. So that's kind of the magic behind oxygenetics in terms of why it's so good and why it's so calming to be used after treatment. They do also have, so that's the regular one with the silver.
Yeah.
They also have one that's great for acneic skins as well, which has exactly the same formulation to it. Still has the aloe vera, the broad spectrum SPF 30, but it has 2% salicylic acid in, so it does have an active.
Wow.
Everything else is the same, and I use this and I mix it with an exuviance tinted product. And it's so good, and it stays. It does.
Do you know what? I think that would be very popular in Cayman, because particularly with the humid climate, we're just coming into the hottest part of the year now. So which you think would be enjoyable, but it actually gets too warm, very, very humid. And I mean, I notice personally, but I know a lot of my clients notice that they really start to get more breakouts in the skin, and even people that don't necessarily have acne issues will notice that their pores are more clogged and that they're starting to get that real kind of acne outbreaks in the T-zone area. So that would be a really good option for someone who is looking to still wear a light covering of makeup and get that added benefit.
Oh, and one other thing on that note, although we are just literally about to take pre-orders for this, is the Skin Better Science SPF 50. So this is the Tone Smart. Yeah, this is, Oxygenetics is great. I love Oxygenetics, but I really love this. This is the Tone Smart. It's SPF 50. Mine's nearly run out, so I can only, it's nearly, I'm so mortified. But this is UVA, UVB, infrared, high energy visible light. So it blocks out, it targets all of the known spectrums, like it's got blue light filters in as well. Sabolol, it's antioxidant, it's a very, very, very sophisticated anti-pollution formulation. So the only thing that's missing that I've taken out is it has a pad you can just apply, and it easily blend to Fitzpatrick types 1 to 4. It's not ideal really on the darker skins. I think really Oxygenetics, because you've got 40, that is better. But this is far more sophisticated as an all-round day-to-day anti-aging formulation. It's a physical SPF,
and so it's a powder, more of a.
It's more matte, much more matte than that. So can you see? It's kind of like it's like a solid.
Okay, yeah. And it comes in one tone. It comes
one tone, but it will blend easily to Fitzpatrick's one quite comfortably, and that's really lightweight. Coverage wise, that's better coverage.
Yeah.
No, this is lighter, but has higher SPF, has more protection against a broader spectrum of wavelengths. So it's a difficult call. What I do, I use as a primer, and then put it on top.
If you need a little bit more coverage.
Need a bit more coverage, but you can also use this immediately after treatment as well. Even after things like microneedling, the clinicals that we've got from Skin Better Science, this can go straight onto skin after needling.
Which, do you know what, that's a huge barrier some of the time with getting treatments, chemical peels and microneedling and even Botox fillers, that people don't want to go into work red and with little bits of bruising and things like that. So to have an option to be able to put makeup on straight afterwards, I think would be a big encouraging factor for people.
Yeah, so these are my two favorite SPFs. I love them, and that, it's a personal choice. We have got a massive variety within our port. We have like close to 13 brands now within the aesthetics portfolio, so there's a lot of choice. But for me, I've oily, acne prone skin, so these two are great because they don't flip up, and they're anti-aging and they give coverage. So yeah, they're great. Anyway, sorry, there were questions.
It's
Sorry.
fabulous. No, I mean, do you know what? You probably have answered a lot of the questions as we've gone along. Now, I did get a question from Jennifer that was specifically asking about postmenopausal skin. And she sort of then said, with a particular focus on the kind of under eye and crepey sort of cheek hollows. But her key sort of question was about postmenopausal skin.
Okay, in terms of like
In
trying to get the
terms,
nourishment.
I think in terms of which products you would particularly recommend for the postmenopausal skin.
I just got to show you something. Hold on, just sorry, 2 seconds.
No problem.
These actually might be nice for you to think about. So Skin Better Science do entry-level kits that are smaller versions of the bigger sizes.
Okay.
Nice cost-effective option. So I'm showing you this because there is another technology within Skin Better Science which uses, again, like the delivery system, obviously for the alpharets, novel proprietary. They have another interesting delivery system which is able to get injectable grade hyaluronic acid into skin. They have something called the Interfuse range of products. There's one for the eye, there's one for the face and the neck, and there's one that you can actually use in individual lines in the skin. And these little entry-level kits here are great because they have all of those in smaller sizes. So actually, to be fair, you have the Interfuse lines is 5 ml. The eye one is also 5 ml, and then the face and the neck one here is 15 ml. But normally, as I say, we've got like we all have it in a bigger size of the 50 as well. But the Interfuse technology, because I think the controversy's been with using things like hyaluronic acid in skincare is like, well, it doesn't do anything. You know, it works well as a very superficial humectant, but the molecular size, needs to really be less than 500 kilodaltons. Otherwise, it's not going to do. You know, it's a great experience again and whatever, but that's it.
Yeah.
So this has been formulated with a very sophisticated delivery system, which is the Interfuse technology, which means that the molecules have been modified to have like a lipophilic coating within them, and there is a special type of neuropeptide in the formulation which temporarily like relaxes the outermost layers of the skin cells to allow the technology and the molecules, like these massive molecules, to get in and actually nourish the skin at the deeper layers. So for those menopausal skins that are very hormone depleted, hormone unbalanced, but very, very dry and suffering from laxity, my first stop shop now is those three. I mean, that's like an entry level kit, but I often offer people that because it's far more cost effective to try. Love it. The Interfuse eye particularly is so good. You can use it all the way around the eye, over the lid. It's an ophthalmologically tested product.
Because we did, funnily enough, we actually did. The next question was about eyelids, and a little bit of the sort of skin laxity. I think it was. She was saying. So it was Regina was asking about upper and lower eyelid sort of skin folds and skin bags. So that's very interesting that you say that you can put that right around the eye.
Absolutely. They will, yeah, Interfuse eye is probably like, we have a great one in the Neostrata Skin Active line as well called Intensive Eye Therapy. That's also amazing, and that's designed to go, again, because it's ophthalmologically tested, over the entire eye area itself. But Interfuse eye actually utilizes more sort of bioavailable hyaluronic acid, and we see comparable outcomes. So either of the two. In terms of texture and feel, the Intensive Eye Therapy from Neostrata, I think, has more of a mattifying effect to it, if you like. And it's a sort of halfway house between, I suppose, almost a gel and a serum in terms of its consistency. It's very lightweight. It's a lovely product. These feel more emollient and rich. So I think for the kind of skins we're talking about, the menopausal, that relaxed crepe skin across the eye, I'm actually now favouring. They're both great products, but I'm actually now favouring the Interfuse.
And I think that was an important point that you were talking about the products penetrating into the skin, because that is such an important point that we often forget about, that all these amazing ingredients are lying on the surface of the skin and they're unable, unless they've got that advanced technology or some mechanism for which they can penetrate into the layer that we need them, they're not going to be having the effects that we think they are. So yes, I've been sort of trying to talk to my ladies a little bit about, you know, educating them about key ingredients, but also it's so important to know a little bit more, if they can, about the technology behind these kinds of products and why some are more successful than others about getting into the layer that we need them to be. So that's a really important point.
And I think it's a real, I'm not trying to big them up, but I think it's a testament. I feel very proud of the products that we have in our portfolio because we know they work. There's such strong evidence and very strong clinicals behind all of them. Like the Neostrata company were the guys that actually in 1974 found and put the patent on glycolic acids. You know, so you know, the brands we've got are very pioneering. We've never seen the kind of proprietary delivery systems for like this vitamin A. You know, the Alpharet story doesn't really exist anywhere else. You know, and getting those kind of like injectable grade weights of hyaluronic acid into skin is like, it's not really been possible before. And you know, there are the outcomes in the studies to demonstrate that, you know, it's not just like before and after. That, you know, technology works.
Evidence-based. Yeah, absolutely. So I think we've covered, Renee was sort of asking a little bit about the neck, but actually I think you've covered a lot about the sort of neck and chest area, which is wonderful. So moving on, Emma had a question about her 74-year-old mother, actually, and it was about treating dark circles under the eyes. I know we talked a little bit about eyes, but dark circles in particular was something a few ladies.
It's the good news.
Is your house just filled with, it's like a little mini warehouse?
It's kept me going lockdown, that's all I can say. Also, I know this is being recorded, I probably shouldn't ask this being recorded. Can you do like a screenshot of us or something?
Absolutely. Do you know what? Why don't you hold up one of your products? Hold up a couple of your products and I can
watch
in your warehouse. Perfect. And do you know what? I'll keep snapping a few as well, so that I've got a few when you're talking. So brilliant. Absolutely, good idea. You're better at me than thinking about things like that. So absolutely.
You tell me your social media handle. I'll be sure to tag you in. So
fantastic.
Right, dark circles. Okay, so back to the Neostrata technologies now. Again, this has been in the portfolio for, my goodness, such a long time. Gold standard technology, it works. Now, under eye dark circles, I think, are a tricky one. They're a really tricky one in a dark skin population. We stand a better chance of treating them effectively and reducing the appearance of darkness if we deem in our assessment that it's the darkness that's caused, if you like, by the fragility or the vascularity of the skin itself. Okay? Not if pigmentation is the cause. We are limited in terms of what we have in our portfolio in terms of lightening that area, because of course if we go in too strong and too heavy-handed in such a delicate area, there will be adverse effects.
And particularly with sun exposure, if you're combining that, you know, trying to treat that delicate area with strong anti-pigmentation products in you know, a high UV lifestyle, recipe for disaster.
Absolutely. Then you can, you know, trigger all kinds of like post-inflammatory problems, and then you just end up in a really difficult vicious circle. So better to go gently and have like a maintenance treatment plan rather than, you know, like a course and then nothing. The Bionic Eye Cream Plus is amazing. So this has low percentage of vitamin C and vitamin E, and barrier conditioning ingredients really to strengthen and to hydrate the skin. It's ophthalmologically tested, so it's designed to be used under the eye, and it's actually sort of perfect really for this under eye region. We don't tend, this is not really designed to actually target the laxity over the upper lid, like we talked about, with the Interviews technology or the Skin Active range. This is about really trying to get the skin as strong and as conditioned as possible, so that if anything, the light falls off the skin better, it deflects, the darkness looks less prominent, or the condition of the skin improves. The only thing we have to be very careful with this is quantity is key. Things like the Skin Active, the intensive eye therapy from Neostrata Skin Active is in a pump, and also the intensive eye therapy is in a pump. So you're quite metered, if you like, in terms of knowing how much to use in certain areas. This you need to sort of manually dispense, and it's a very rich emollient formulation. I don't know if you can see that very clearly.
Yeah.
And all I'll say is, if people overuse this, it will precipitate things like milia or localized congestion under the eye. So very, very, very judicious use. Half a grain of rice, literally, for both eyes, because it's not going over the top lid.
Which is great because it's going to last longer as well if you're using,
Exactly. So to be clear about quantity, again, we're talking about literally that's enough for both eyes.
Both eyes.
Really, because again, most individuals are going to be layering a series of products at least once, or if not twice a day. So anything more than that, anything else is going to feel heavy. It's just going to roll or pill on top of the skin, or, as I say, worst case scenario, get that localized congestion. Then the product gets blamed. People don't want to use it when actually it's just been overused. So, I'm the world first at stuff like that, so I do understand. I'm like, well, I want results now, so I'm just going to go for it and do it 4 times a day, or I'm just going to put 4 times the amount I want on because I want it now.
Yeah.
I do understand.
And do you know, I think with eyes, again, a little bit like the neck area, I think it's important to have topical formulation like that to work alongside treatments like under eye filler, or because if there is that real dent and that real defect, all the light is going to be catching in that area, causing that real dark circles. But you can't have one without the other. You can't just fill the defect and then expect not to condition the skin and not to use a topical formulation, and vice versa.
Exactly. And I think we see much more now, thanks to treatments like Profilo and other treatments that have come to the market and revolutionized how and what we can do with skin quality now. It was unthinkable like 5-6 years ago. But yeah, I think so many individuals, when we look at them and they come saying, well, it's my tear troughs, because that's what they've seen on social media, and you think, well, actually, no. I think if we address the skin first and we see what kind of improvement we've got, often maybe that has commercial implications, whatever, but I think obviously it's about doing the right thing. But I think that a lot of the time it is just, as you say, like maybe the formulations are enough as a standalone, but whatever, it's a great place to start. And as I said, again, at least until we can start treating patients.
Great. So we had 2 more questions. So Regina was also hoping to pick your brains on broken capillaries from severe type 2 rosacea. So I don't know whether that's going to be something you can give advice on or not, or possible or not, but I'm going to ask the question anyway.
So we don't have anything formulation based within our portfolio specifically to just treat the presence of fine vessel telangiectasia, which I'm assuming is probably across here from severe rosacea. That type of presentation, in my experience and opinion, is generally best addressed with IPL or even laser, and like vascular treatment. That's my opinion. However, from my experience, again, wherever I've seen a lot of severe areas of telangiectasia, there is a level of diffuse background redness as well. So topically, that can absolutely be addressed, no question at all. We have a product, actually I didn't mention it to you, Imogen, but we have a product within our Neostrata range called our redness neutralizing serum, which is designed specifically for treating that, that malar redness.
Yeah.
And that does work brilliantly. And it's a botanical derivative. It has ingredients in it like Canadian willow herb extract, which are very good at like calming skin. White tea extract by Sabalol. It's antioxidant rich, and again, it has ingredients like lactobanic acid in it as well. It's
Build that skin barrier.
Exactly, to build the skin barrier. So that, and we actually use that immediately after a peel. It's that gentle and it's that good at taking redness down. So that would be my recommendation, product-wise, to actually treat the background redness. But I think in terms of if it was just the telangiectasia that was an issue, I don't know what your thoughts are on that, Imogen, but
I agree.
I think you kind of need to look at those other in-clinic treatments really just to target those areas.
Yeah, agreed. And our last question, and again, you've touched a little bit on this already, I think, with the Alpha-Ret technology. But Caroline was hoping to know a little bit more about smoother skin, so improving texture of the skin. So I don't know whether the Alpha-Ret would still be your top choice on that.
Oh, for sure. So Alpha-Ret is a really great option. We actually, that's one thing I should mention, actually, we have this in 2 strengths. We have, so as well as the sort of the retinol, if you like, the ethyl lactol retinoate, which is the double conjugate molecule, we also have glycolic acid in it as well for added retexturing benefits. Now, and the entry level strength is the Alpha-Ret overnight cream for the face. This has 10% glycolic in, and then there is also an intensive version of that with 18%. Right. So the overall Alpha-Ret technology, all the other ingredients are just the same, but they have the the step up.
So is it still called the overnight cream, or is it a different? It just comes in 2 strengths.
Yeah, it's still called the Alpha-Ret overnight cream, but it's just called Alpha-Ret overnight cream intensive. That's the only difference, and that's the one that's indicating that there's the 18% glycolic rather than the 10%. Most people, in my experience, though, find that they get such great results of this with like barely any sensitivity or irritation, that they're quite happy often staying at that percentage. I use the intensive, but that's because my skin is so well conditioned to anything acidic.
Yeah.
So I'm, but in the same breath, we would always start somebody off on the entry level first
and build up.
And then let them build up, because it's quite a big jump up to that high level. So yeah, so this is a great option. Also for gentle retexturing, so we've got a Neostrata peel pad equivalent of these as well, which have 10% glycolic acid in our daily resurface peel pads. They also have 36 pads on a formulation that the patient or consumer just literally pours and decants that 10% glycolic acid solution in. Also has aminophyllin as well, so it's anti-aging benefits as well. You can face the neck, areas like the elbow that are a bit rough, and also there's the Alpha-Ret peel pads as well, which have the lactic acid and a little bit of salicylic in as well. So lots of options, I think.
Brilliant, wonderful. What a wealth of knowledge and experience, and I'm so delighted that you've spent the time going through your top picks, answering all of our questions. I know the ladies are going to be really excited to hear you speak, and also grateful for answering all their questions. So really appreciate it. Appreciate your time, appreciate your expertise. And I hope at some point we'll be able to do this again, because you know what, I found this really informative as well. So thank you, Anna.
You're so welcome. I hope it's been helpful. And just email me if you've got any kind of product related questions. I mean, we've got like so much in our portfolio. I'm still just looking, thinking. You know about Peel to Glow as well, don't you?
Do you know what? I have just sort of started exploring the Peel to Glow, and the first few clients in Cayman have just in the last kind of week or so received the Peel to Glow. It wasn't something that I was familiar with before, and then I sort of introduced the idea in a few of the tutorials that I'd been doing on the group, and people were messaging me requesting, oh, how can I get this Peel to Glow? So now the first lot of ladies, I ordered it in for them. The first lot of ladies have got their Peel to Glow. And so I'm waiting to hear back actually on their sort of feedback really on that at the moment.
Right. Okay. We'll keep you posted.
Absolutely.
Like there's 4 different types now. So we've got brightening and bloom, and skin filling. So there's one there that's got just a little bit of extra tranexamic acid in for pigmentation. And then we launched 2 newer ones to market, one of which you use more overnight, one of which has that lactobaric acid in, so it's really good for more sensitive skin. So there's a couple of different options that we've got now. So yeah, we've got 4 different types in total.
And you know, that was one of the home care appeal, particularly at the moment, again, like you were saying, that we can't be doing the in-clinic treatments. The home peels, I think, have been even more popular. And you know, really appealing to people. And actually, on a personal level, I'm really excited to try it myself. So I do you know what, I honestly, I always find my Botox runs out the first. I never get the skin treatments I want, because we shipped over such a huge box of product on request from all the ladies here. There was no room in the box for anything for me. Cobbler's children run barefoot. I had to prioritize my ladies. So I'm next on the list.
Yeah, I hear you. I'm like,
oh, well, so wonderful to chat, Anna, and I'm sure we'll be in touch soon. And thank you again for your time and expertise. And it's always lovely to chat to you, and hopefully at some point we can do this again.
Absolutely, just email me if there's anything you need. Oh, and email me. I'll put my number on the email. Can you WhatsApp me those pictures? Did you do them on?
Absolutely, I took the pictures. I will WhatsApp them straight to you. And my social media handle is WS Aesthetics, so I can send you that as well. And I'll be posting this interview on the Skin Transformation group on Facebook as well. So hopefully everybody will be able to get all the information from you.
Brilliant. Thank you so much.
Wonderful. Thanks, Anna. Enjoy the rest of your day. Bye.